Now then, up to 25,000 ambulance workers on strike again this morning as the long-running dispute over their pay and conditions rumbles on.
Well, yes, it's the second strike and it comes as a Good Morning Britain survey into public opinion on the NHS in general has found only 13% of people would trust an ambulance to turn up and get them to hospital in an emergency on a normal day. Nearly 70% would rather rely on their own transport, friends and family to take them.
Here's some more stats for you. Once actually there at the hospital, 57% of people are not confident anymore that the NHS would be able to treat them both quickly and efficiently. But despite that, just over half of those surveyed said that they support ambulance workers going on strike today and later in the month, a clear majority.
Health Secretary Steve Barclay joins us now from Westminster. Very good morning to you, Steve Barclay.
Good morning.
Good morning.
If, God forbid, anyone you knew suffered a stroke today, what would the response be if you called 999?
Well, the advice to any of your viewers, Susanna, is if it is a life-threatening incident, then they should phone 999. And we were working with the trade unions till midnight last night in terms of the safety levels that they would cover. They've agreed to cover all the Category 1 calls, which is the most...
Category 2.
It is. I was just coming on to that. So they've covered all the Category 1 calls. Category 2 is variable in some regions. The unions are saying in a number of regions they'll cover them entirely. In some areas, it is subject to decisions taken in the control centre. So to take your example, the discussions we've had with the trade unions is they would cover those calls. But what's within your question, I think, is a very fair point, which is sometimes other conditions which may not get the response that it should. Over time, a condition that is less serious can become very serious when there is a delay. And that's why we announced in the House of Commons yesterday that it is appropriate to have minimum service levels, so we can be in a position where...
Sorry, Mr Barclay, I'm not talking about legislation that you're intending to bring in at some point in the future. I'm talking about today.
OK.
If I know someone who's having a stroke today, right now, you're basically saying that you cannot guarantee that an ambulance would come out within the time necessary to save that life?
Well, we're saying that people firstly should phone 999 where there is a genuine life-threatening incident. So your example, of course, they should phone 999. We've been working with the trade unions in terms of what cover they will provide. In addition to that...
Mr Barclay, I'm sorry, what is the answer to the question? Can you guarantee, if someone I know has a stroke today, that if I call 999, an ambulance will arrive?
Well, we put contingency measures in to try and address that, but the whole reason why we don't believe there should be strikes is because of the seriousness of issues like this.
So you haven't managed to come to an agreement with either local trusts or the unions that strokes would be covered?
Well, the indication to us from the unions and through the delegations last night is, yes, strokes would be covered. What there was still debate going on was whether all of the Category 2 calls, not all the Category 2 calls are strokes. The most serious, what's called a 2A, is a heart attack and stroke calls. And the unions were saying to us those would be covered. And that's what the delegations we were discussing with them was to ensure that is the case. And on top of that, of course, we ourselves have been putting in place additional contingency measures. So the focus is on responding to those Category 2 calls.
Basically, someone has to diagnose themselves or during the call that it is a stroke or a heart attack.
Well, this is why we don't think the arrangement we have in place is acceptable, and that's why we are going to legislate on it.
How can you, as Health Secretary, be able to say that? It is unacceptable. And to be honest, it's unacceptable on a normal day. We can't even guarantee that an ambulance is going to come out for stroke today, on a strike day. But the target time response for emergency calls in the case of a stroke is 18 minutes. This has not been met nationwide for almost 3 years. This isn't just a problem today. Part of the reason that the workers are on strike today is because they cannot get out in time to save people's lives under this government on a normal day.
Well, it's not just under this government. These are challenges that we are seeing with the ambulance service in Wales, the ambulance service in Scotland, where it's under a different governments. It's also challenges we're seeing with health systems across Europe. So this isn't a challenge simply within England. As a consequence of the pandemic, we recognise that health systems are under massive strain. What we also saw over the Christmas period was a huge spike in flu cases, a 7-fold increase in a month. There's more than 100 times the number of patients in hospital currently with flu compared to this year. So the system, as a consequence of the pandemic, is under very severe pressure. I absolutely accept that. And as I said in the House of Commons, that is why we've seen the pressure in emergency department and the delays in ambulance handover times. In the autumn statement, we targeted additional funding for this. So the government is responding, an extra £6.6 billion into the NHS, an extra £7.5 billion into social care over the next 2 years, because we recognise whilst a lot of the focus, understandably, is on the pressure on ambulance handover delays, actually what is driving that is around 13,000 patients in hospital who are medically fit to leave, but are delayed from doing so, often because of social care. Well, so that is why we're making a range of changes and why we're putting additional funding into it.
Well, you talk about this range of changes and you talk about the extra funding, but the fact of the matter is, and I find it almost incredible to hear myself saying this, but our survey of our viewers, a cross-section of the British public, shows that only 13% of people basically trust the 999 system. They don't trust an ambulance to get to them in time, to get them to hospital in an emergency. They would rather go in their car if they can drive, or be driven, or ask a friend to take them, rather than an ambulance. Now, I would put it to you that even 3 to 4 years ago, if you'd asked the people the same question, you would have got nearly 100%. I certainly would have said, of course the ambulance will be there in 4 or 5 minutes. And now, 13%, just 13% accept that it's going to come on time. How on earth are you going to overturn that?
Well, in a way, Richard, that's the point that I also was making, where when people say this is about 12 or 13 years, it is about the consequence over the last 3 years of the pandemic. If you look at ambulance handover times going into the pandemic, you're right, it wasn't a problem in the same way it was. It was slightly over target. So to take Susanna's question on Category 2 calls, it was just under 24 minutes, so more than the 18 minutes that the target, but nowhere near what it's been as a consequence of the pandemic. So we have seen huge pressure, not just on the English NHS, but in Wales, in Scotland, across Europe. My French counterpart was talking recently in terms of their intensive care beds being at saturation point. In Germany, the health system has also been under significant strain.
What do you make of the fact that, sorry to interrupt, but we're tight for time, that over half of our viewers support the strike today? And 54% of women in particular support the ambulance strike today. What do you make of that as the Minister responsible?
Well, I think the public can see that our NHS is under very severe pressure, and also see that the staff who are working incredibly hard themselves are under very severe pressure. I see that myself.
How are you going to fix it, Mr. Barclay? What are you going to do? I mean, I don't think it's good enough, frankly, for anyone today to hear you say, oh, well, they've got problems elsewhere, so, you know, this is universal. The fact of the matter is, you're the Health Secretary in charge of the NHS here.
Yes.
What are you going to do to fix it? What are you going to do to make sure that we have a minimum service on non-strike days, let alone see ambulance workers walk out on strike?
Sure. So let me answer that. If I just take the last 2 days in the House of Commons, on Monday I set out a package, a further 250 million of immediate action that we can take to release pressure on emergency departments, put some extra capacity there, but also to support local authorities and integrated care boards in terms of block booking beds in residential care homes, so we can get those patients who are ready to leave hospital into residential care homes and relieve some of the pressure on emergency departments and ambulance there. So that's the first thing. The £500 million that was announced in the autumn statement enables integrated care boards to target additional support for workforce. So there is provision there, particularly in the social care sector.
Are you going to pay them more money?
In terms of, well, again, there's a difference between whether your question's about the social care sector, Susanna, or whether it's on the nursing side. I was meeting with the nursing unions on Monday to discuss this coming year's pay review body, the evidence that is going into that. That will take effect from April to take on board.
More money?
Well, these decisions, quite rightly, are for a pay review body. Even the opposition, even the Labour Party, support a pay review body process.
Are you going to pay them more money?
What it needs to do, well, you can say that is a decision that the pay review bodies will look at. What we're doing is working with the trade unions in ensuring that the evidence on affordability, which looks at both what is affordable to your viewers with cost of living pressures in other jobs, what's affordable to that wider economy.
I don't want my nurses, my ambulance workers or 999 call handlers on strike. I want to know that if something happens, I'm going to call 999 and an ambulance is going to come within the target time. They say they want more money. Are you going to pay them more money?
Well, it's about getting the right level of pay for recruitment and retention, and that is the discussion that the pay review body will be looking at, and what is the right level of additional pay in this coming year for us to be looking at. Okay. But it's not simply about pay, it's also about the issue of ambulance handover delays. That's about getting those patients that are stuck in hospital who are fit to leave out, because that in turn enables the ambulances to drop off.
We just want to know what the solution is. But,
well, it's the package I set out on Monday in the House of Commons. It's also about having minimum service levels to guarantee, to your question on stroke cover, so we can be absolutely clear that the Category 1, Category 2 calls are covered as minimum safety levels, as they are in other European countries. Okay. And that's why we're bringing that legislation forward.
Well, looking at where we sit today and looking at these figures, these public opinion poll figures, you have an Everest to climb, and you ain't going to get there in a day. Thank you, Mr. Barclay, for joining us.